Welcome to What Do You Want to Be When You Grow Up Wednesdays. And I'm really excited to have Sara with us today. She's a registered massage therapist. And thank you for being here, Sara. Can you tell us about yourself?
So I've been a registered massage therapist for, actually it was about a year last week. Now I'm thinking about it. I'm originally from the UK and I moved to Canada 4 years ago and needed to find something to do with myself. So I went back to school and trained to be a registered massage therapist.
Can you
What else
tell
do you want to
us
know?
about your vision?
Oh, sure. I'm totally blind and I have been probably since I was about 4 years old.
Can you tell us, so what is a registered massage therapist and what are the kind of places you could work?
Okay. So what we do is we treat, we use various massage techniques, so hands-on techniques to treat people for a whole range of conditions, mostly to do with muscles, so muscle strains, sprains, and we can also help with things like stress reduction, also conditions such as if someone's had a car accident. I treat a lot of patients who have whiplash, so after they've had a car accident, that kind of thing. A whole range of different conditions. And as for the various places that you can work, you get a lot of massage therapists working with athletes, so sports teams. When I was at school, I went out and worked with the athletes out at UBC. Also, you can do various event work at Vancouver Marathon, things like that. My practice at the moment where I work is pretty general, so I see a whole range of the population, including office workers who can come in with, stiff shoulders, backs, necks, that kind of thing. Again, like I said, people who have been in car accidents. I've also treated people with spinal cord injuries, so those people in wheelchairs or those who have had a stroke who are going through rehabilitation. Yeah, a whole range of different things.
Awesome. What attracted you to this career?
Do you want the long story or the short story?
Whichever you feel like sharing.
Okay. So when I was 16, I ended up getting a back injury through competing in judo. And it became what they thought was very simple injury that would heal quickly, didn't heal. So it ended up becoming a long-term thing. And in my 20s, I had a very stressful, pretty unpleasant office job. And because of the stress and sitting at my computer all the time, kind of made my back injury worse. So I ended up seeing physiotherapists and massage therapists. And both of those seemed quite helpful. So I guess I got interested in it through that, really. Like I said, my own job was quite stressful, and I saw people coming out of these guys' treatment rooms, and I just thought, oh, it must be really nice to have a job where people actually like you and are nice to you. So I actually started my training in massage back in the UK. And I worked as a massage therapist there for a couple of years. And then I moved to Canada, and it's very different over here because in BC, a registered massage therapist is is part of the healthcare profession. So it's a lot more, the setup here is a lot more professional and regulated. So that's why I had to go back to school.
So what kind of schooling do you need in BC to be an RMT?
Well, I'm not going to lie, it's pretty tough. So basically when you go to school, the qualification you come out with is a diploma. It's a full-time course and it lasts for 20 months. So that's 5 semesters. Um, you can go into it straight after school. They just require that you have your high school, what do you call it? Like you've graduated high school. It does help if you have some kind of like science background. I didn't, but a lot of my friends did, and it was helpful. But yeah, you can go straight from high school if you want to.
And are there practicums? Is
Yeah.
it?
So the course comprises of two, I suppose, simply put, yeah, three elements, I guess. So you have academic classes, which teach you all of your anatomy, all about the body, and you have to learn all the muscles, where all the muscles are, all kinds of things like that. And then you have the practical classes, which teach you, the massage techniques, how to assess a patient, because when a patient comes in, you don't just massage them, you have to learn to assess what the problem is. So they teach you that. And then you also get taught therapeutic exercise, which is when you've finished a massage treatment, you don't just send a patient home, you have to give them exercises and things they can do at home to to help them progress and get the full benefits from the treatment you've just given them. So teach all that stuff in your practical classes. And then the other aspect of the course is the clinic and the outreach program. So you have to complete a certain number of clinical hours. Now, each massage school has its own fully functioning clinic, and you go up there and you treat members of the public who come in for massage. And all of the schools will also do a range of outreach programs. So ones I went on were, like I said, we went out to UBC. We also went to GF Strong, which is the Spinal Cord Injury Center. Various care homes for older people. And then we also treated the staff at Surrey Memorial Hospital. So it's pretty varied, the stuff that they send you on, and it really gives you an idea of the kinds of people you can be treating when you've finished school.
What accommodations did you require during the schooling and the training and the practicums?
Yeah, not too much. The big one is diagrams. So a lot of, especially for your academic classes like your anatomy, that kind of thing, they do use diagrams a lot. So for me, whenever we had a test, they would have to pull out the diagrams and give me written based questions. I have never used diagrams, so I didn't find it a problem. When they were referring to diagrams, I didn't personally find that a problem, but if I was confused, then I would just see them after and get them to explain anything that I'd missed because they were pointing at something in a picture. But so I'd say diagrams was the main one. They will give you extra time in quizzes and tests if you need it. I didn't, because all of the exams they give you are multiple choice. So it's like you literally just go down the paper and you tick the correct answer. The only exams I did ask for a bit of extra time was on ones where if they were quite scenario based. So some of the questions there'll be like a long written explanation of telling me, like, give me an example of, like, if I've had a patient, and they'll give me a lot of detail in the questions. So if it was one of those kind of exams, then I'd have a bit of extra time because it takes me a bit longer to read, but usually I didn't need it.
What about like people from like in the clinic serving the public and people coming in and being maybe surprised that their RMT is blind? How did you respond to that, or was that an issue at all?
It wasn't actually. The school did ask me at first, if I wanted to let people know beforehand that I was blind, I said I didn't want to, because I didn't want anyone coming in with preconceptions or choosing not to have me treat them because I was blind. And I also believe, you don't let people know about other things. You wouldn't necessarily let someone know if you were asthmatic or if you were black or white, so I didn't see it as relevant. And the only thing I did let them know was, before they came into my treatment room with me, I would say that I had a dog, because I have a guide dog, and obviously some people have dog allergies or are afraid of dogs. And if that happened, then I'd just give the dog to our receptionist for an hour or so. But yeah, it was never really an issue.
Are there personality traits or special skills you think are important for this position?
I think you have to be a good listener, and I think you have to be good at asking questions, because people don't always tell you what they should tell you. They tell you what they think that you want to hear. So, the amount of times I've been treating someone and I've been like, oh, I don't know why they're not getting any better. And then suddenly they'll, like, literally 2 or 3 treatments in, they'll suddenly come out with a piece of information that actually would have been really relevant at the beginning. So I think you have to be quite good at listening to what they're saying, but also asking the right questions and getting the right information from them. But also, what else? You have to be pretty empathetic. Like, even if you've never been in their situation, you have to be pretty good at trying to imagine what it must be like to be in that situation. Because, you get a lot of people who have been in a lot of pain for a very long time. You might not have ever had that problem yourself, but you have to try and put yourself in their position, and because it really helps you to figure out why they're not doing something or why they can't do something.
What do you like most about your job?
Well, I used to have a job working on a computer all day, every day, sitting at a desk. So I really enjoy the fact that I don't do that anymore. I get to talk and meet lots and lots of different people every day. I never know who's going to come in my door. Everyone is different. Everyone has like different stories to tell me, or so I love that part of my job, and I love being able to help people. It's really nice when you have someone who comes to you and they're stressed out or they're in a lot of pain, and then they come to you like a few treatments down the line and they're like, oh yeah, it doesn't hurt anymore, or I can walk properly for the first time in 3 months, or stuff like that, or you get them back to being able to run or do something that they love. That's really satisfying.
That's awesome. What do you like least?
Okay, so a couple of things. This most simple one is people aren't always freshly showered when they come in, so sometimes, especially if you're in the sports situation, they're kind of sweaty and it's not always great. But another thing I think is when the reverse of what I've just said is when you can't help somebody. So when they've been coming to see you and no matter what you've tried, they're not getting any better, that's difficult. And then, yeah, so, when you have to say to them, I can't help you anymore, or that's hard. That's definitely hard. Also managing people's expectations. So, someone will come in and they're like, well, how long am I going to take to get better? And they want you to put an exact number on it, like 2 days or 3 days, and you can't do that because the body doesn't work like that, and that's difficult.
Mm-hmm. What kind of salary can somebody expect to make as an RMT?
Okay, so that's a little bit tricky because actually as an RMT you're not employed. Most RMTs are self-employed. So that means that you don't have a regular monthly salary. What it also means, though, on the flip side of that, is that you get to pick and choose your own hours. So you can basically set your own schedule, um, do as much or as little work as you want. It's not quite as clear cut as that, but simply put, that's how it works. Most RMTs, including myself, work as subcontractors. So that means that you work out of a clinic, usually with other RMTs, or in my case as well, physiotherapists and chiropractors and other people. So that means that you, although you're self-employed, you pay rent to the place that you work, a bit like, you don't get anything for free. Like I said, it's not, so I'm trying to give you guys a straightforward answer, but it's kind of difficult. But on average, my clinic, we charge people $115 for an hour's massage. So I don't get to see all of that because some of that I have to pay in rent. But yeah, that gives you an idea. It's about $115 an hour.
Nice. Have you had any vision-related challenges in the job?
Yeah, so there's a couple. One is a lot of people, sighted people, will do a lot of their initial assessments of people visually. So they will look at how somebody stands, or they will look at how somebody walks and moves. So obviously you have to figure out a different way of doing that. So I do mine hands-on. So I generally, before I get them on the table, I'll get them to stand in front of me and I will check their posture. So whether their shoulders are at the same level, or whether their hips are aligned, that kind of thing. And when I'm getting them to move, so if someone comes into me and they've got a bad shoulder, I have to get them to move their shoulder. So you have to be hands-on with that, and you have to explain that to your person. So, hey, I'm going to get you to like move your arm up in the air, and while you're doing that, I'm going to have my hand on your shoulder and feel what your shoulder's doing. You can't just go and touch somebody without asking their permission first. They'll pretty much always give it, because at the end of the day, they come for a massage, so they're kind of expecting to be touched anyway. So that's one. It's not a big issue, but it is definitely something you have to be aware of, especially when you're going through school, that aspect of it may be slightly different for you. Mm-hmm. The other one is record keeping and note taking. So most massage therapists use a computerized software to do all of that, to store all patient notes and files electronically. It works fairly well, but there are definitely parts of it that don't work so well. So luckily for me, all the bits that I need, so seeing what patients I have booked in and writing and reading that's fine. The stuff that doesn't work is more administrative. So I can't, for example, if I wanted to, I couldn't actually book an appointment with a patient using that software. But most places that you will work have receptionists to do that kind of thing for you anyway. But yeah, software was a little bit tricky.
Mm-hmm. What advice would you have for someone with a visual impairment who's interested in pursuing this career?
I would say definitely go for it. It is a really good career. If you're visually impaired, there are very few barriers to entry. Yeah, I can't. I mean, I've worked in 2 clinics since I graduated, and yeah, you don't. I've never had a job before where it hasn't been an issue, and with being an RMT, I just pretty much walked into the jobs with no problems at all. So yeah, I do think it's very, very accessible if you're visually impaired. I would say be very clear about how you learn, because not everyone learns in the same way. So like for me, the diagrams and the fact that they use diagrams so much, it wasn't an issue, but I could see that some people might find that difficult. You have to be quite prepared to kind of say what you need. Not in the career, but when you're going through school. Like if you're struggling or you don't understand something or you need them to do something differently, they'll do it. They'll absolutely do whatever you need, but you have to know what that is and be prepared to, talk to people about it.
Good advice for any career, I would say. Be able to advocate for yourself.
Right. You've got to be your own advocate for it.
Awesome. Well, thank you, Sara. That was super informative, and maybe there'll be a whole new slew of massage therapists coming out in a few years. Thank you for being here.